Hello and welcome to Ann Talks, recording for nurses by nurses. I'm Curry Bordelon, your host for today's recording. Today we're going to talk about communication and how effective communication can improve patient safety and outcomes, along with how important it is to have communication among your team. So communication is a vital element in healthcare delivery process. Effective communication among healthcare professionals, families, and patients improves health outcomes as well as patient and employee satisfaction. There are evidence out there that indicates that ineffective communication is one of the leading causes to medical errors and unnecessary preventable harm. According to the Joint Commission, over 70% of sentinel events are the result of communication failures. That's an astounding relationship when it comes to patient and medical errors and how communication is one of the main causes for that. Communication is really one of the center points of making sure that information is transferred between care providers and between families to make sure that things are, whether it be medications are delivered effectively, whether it be a treatment plan is communicated effectively, and so forth. Communication is that bidirectional process of giving and receiving information in a commonly accepted language. So if you're in a neonatal intensive care, for instance, that communication is most often geared towards providers communicating with one another in a bidirectional manner, or communication between provider and parent. That transmission of a message from a sender, or the person wanting to convey that message, to a receiver, or that parent or the other provider, is a very deliberate process. This process involves sending a message that is encoded, if you will, based on the language, whatever you're speaking. We've always talked about how, nurses have their own language of certain treatment plans and so forth, and how we communicate with one another and other healthcare providers for that matter. But we have to be very cognizant of how we send that message and how we communicate that message, because sometimes that message may not be understood by the receiver. Say, for instance, you're talking to a parent and you get very in depth with certain medical language and so forth, and you lose that parent, you lose that opportunity. Maybe you're having a communication with someone outside the neonatal intensive care, or even at another facility, another hospital, a referral facility. So be careful and be cognizant of how you're sending that message and how you encode that message to that receiver. Once that receiver then receives that message, they decode it. They want to talk about it a little bit more. And a lot of times they might ask questions. So what I'm hearing, and may even have a statement to make sure they're very clear on that communication. So for instance, I send a message to another nurse. I communicate an idea, communicate a plan of care by phone, by face-to-face. That nurse or that receiving nurse might say, so what I'm hearing you say is, that is closing that loop. That is making sure you're reinforcing that message is clear and concise. Something else to consider is noise that might unintentionally interrupt that message. So as you're communicating that idea or communicating that thought, whether it be the environmental noise, whether it be noise from equipment, whether it be noise from others around you or so forth, or whether it be just structural noise, because that is the noise is anything that can impede that message from being received very clearly. As you get more and more comfortable with communicating in that language or communicating care plans and so forth within others, you start learning that process that makes it more and more clear. But as the communicator, an effective communicator, make sure that message is sent, it is provided to that receiver. That receiver then whether reinforces, asks questions, teaches back. For instance, whenever you're talking to a parent, you're communicating a discharge plan. Have them teach back to you to make sure that they understand that communicated language. So as you can see, communication is very, very important to making sure that care is not interrupted, make sure care is not misconceived, whether it be a wrong medication dose, whether it be wrong patient and so forth. Make sure that communication is clear, make sure you close loop that communication, and have that receiver understand what you're trying to say. I hope this has been helpful. There's lots of online information, and there's information within our website for Academy of Neonatal Nursing that can be also helpful to understand these key principles. Thank you so much for your time. We look forward to seeing you next time.